Eye movement desensitization and reprocessing, EMDR, is a therapy technique designed for working with distressing or traumatic memories. The theory behind EMDR is that many psychological difficulties are the result of distressing life experiences or traumas which have not been stored in memory properly and are said to be unprocessed or blocked. These traumatic memories may need some help to become processed, and EMDR is one way to do this. Normal memories are stored by a part of the brain called the hippocampus. You can think of the hippocampus as a sort of librarian which catalogs or processes events and stores them in the right place. However, some traumatic events such as accidents, abuse, disasters, or violence are so overwhelming that the hippocampus doesn't do its job properly. When this happens, memories are stored in their raw, unprocessed form. These trauma memories are easily triggered, leading them to replay and cause distress over and again. There are a number of steps to EMDR treatment, and a well-trained and certified EMDR therapist can guide you through these steps. But there are some key elements that are important to know. In the preparation phase, you will work with your therapist to identify a traumatic memory. Then you will be asked to identify an image of the worst moment of that memory. As you bring that image into your mind's eye, you will be asked to identify emotions and bodily feelings linked to the memory that you are experiencing right then in the office. We use these emotions, images, and bodily sensations to begin the process. In order to process the memory, clients are asked to use an alternating tapping called the butterfly hug, or tapping on the tops of their thighs. This alternating tapping allows your mind to go with whatever comes up and just notice what happens in your mind. This process will be repeated until the memory causes less distress and ideally none at all. This alternating tapping is called bilateral stimulation, BLS. Typically we tend to think from a right brain, emotional, or a left brain, logical perspective. However, to effectively reprocess trauma memories, you need to engage both sides of your brain. BLS activates the neural networks in your brain so that your left and right hemispheres can begin to work together. There are many factors that impact how a client will process their trauma, such as type of trauma, complexity of trauma, readiness to deal with the strong feelings that will come with the healing process, length of sessions, 1 hour weekly, extended sessions of approximately 2 to 3 hours, or full-day intensive sessions. If you are interested in learning more about EMDR or would like to work on processing your trauma using EMDR, please contact the Cognitive Clinic via email or phone.